Hello again. So we're going to continue doing the blood vessel lab. I should have taken something to drink before I started the camera. Okay, so I put this in here. This is from your textbook, and I've tried to go through and delete kind of the extra ones. So this should have a list of the arteries and veins that you need to know. So I've tried to take away the ones that you don't need to know. And so what we're going to do is we've really talked about the major vessels around the heart. We talked about the aorta and the vena cava and the pulmonary trunk, the pulmonary arteries, and pulmonary veins. So what we want to do now is we want to work on the arteries and veins of the arms, the arteries and veins of the legs, and then we're going to do the arteries and veins of the thorax and of the abdomen. Sorry, the abdomen. Get my pen again. So I really want to focus now on the arms and the legs. So if you remember, we talk about the blood is going to flow through a tube, and so we're going to learn about the subclavian artery, the axillary artery, the brachial artery, radial artery, and ulnar artery. That's what we want to talk about with the arm. So blood is going to flow through the arm following this set of arteries. We're going to do the same thing with the leg. We're going to take the blood from the aorta through the iliac artery, femoral artery, popliteal artery, anterior and posterior tubular arteries. All right, so let's go to the vein side. We're going to bring the blood back, and we're going to talk about the brachial vein. We're going to talk about the femoral vein, the great saphenous vein, the popliteal vein, posterior tubular vein, anterior tubular vein, and these veins as well. We're going to leave all of this to a separate video. So the rest of this video is just arms and legs. Okay, just want to let you know where we are. I also included this picture. You may want to take it, save this particular image, put it on your computer. This is a picture of a model we have here on campus. So I may use it to say identify some of these arteries and veins. I'm putting it here mainly because I'm going to take blown up images, like I'm just going to take the arm and just kind of take the leg, so that way you can kind of get an idea of how it all fits together. So when I pull little parts out, you can think of it as part of the whole as well. All right. So again, we've talked about blood flow to the head and arm. Okay, so here's my aortic arch, right? So if blood's going to the right side of the head, it's got to go up the brachiocephalic trunk, all right, or brachiocephalic artery, say either one. It's going to branch into the subclavian artery, the right subclavian artery, and the right carotid. Okay, the subclavian artery then becomes the axillary artery. Now, is this true on the left side? On the left side, remember, you have a left carotid and a left subclavian. All right, blood's coming back from the head. Blood's going to come down the jugular, right jugular, internal jugular, the external jugular. Blood's going to come back from the arm through the through the subclavian vein. The jugulars and subclavians are going to form the brachiocephalic vein, and that's going to join into the superior vena cava. So I think we've reviewed what you learned in the last video. All right, so now we want to actually take that blood all the way out to the fingers and toes. All right, so this is just another image. Again, I want to make sure you have as many options as you can. So just as review, these are the brachiocephalic veins, vena cava, jugulars, carotid. So you should be able to look at these and recognize those structures. All right, so let's trace the blood out to the arm. So if you're going out the right side, so this is going to be going out the right side. Blood's going to leave the aorta, the ascending aorta, go through the aortic arch, go through the brachiocephalic trunk, go through the subclavian artery. As the subclavian artery comes through the axillary region, we call it the axillary artery. All right, this axillary, you don't have to know about that one. I should have deleted it. The axillary artery is then going to become the brachial artery. As it goes past the elbow, it's going to then split into the radial artery and the ulnar artery. Remember, your radius is on your thumb side. All right, so this is your radial and ulnar artery. Now, the only difference between the right and left side is in order to get to your left arm, the blood's going to come up the aortic arch. And instead of going through a brachiocephalic, because there's not one on the left side. It goes straight to the subclavian, the left subclavian artery, then the left axillary artery, then the left brachial artery, and then either the right or left, the left radial or ulnar artery. Okay, so the left arm looks the same as the right. The only difference is that brachiocephalic trunk on the right side. Okay, that's the only thing you have to remember that's different. All right, blood's going to come back the same way. It's exactly the same left and right. So the venous side on left and right is the same. So blood's going to come back through the ulnar vein or the radial vein. It's going to come back through the brachial vein. The brachial vein will become the axillary vein. It will then become the subclavian vein, and then into the brachiocephalic vein, and then the superior vena cava. So make sure when you're writing these things, if I say name this vessel, you wouldn't just say ulnar. You need to say ulnar vein. I need to know that you know that it's an artery or vein. So if I said name, this tube, you would say it's the brachial vein. Now I have added two additional veins. You have the basilic and the cephalic vein. The brachial vein is deep. It's very deep, but a lot of people want to know what those veins are that you can actually see on your arm. So if you've got real big muscles and you may see some veins poking out. The one that's, if you have your hands like this, the ones on the thumb side is the cephalic vein, and the one on the pinky side is your basilic vein. So again, it's not necessarily something that I'm going to test you on, but you may want to recognize what those two veins are. I'll just ask you what the brachial vein is, but there are three veins here, so the brachial vein is the middle one. Now the additional vein is called the median cubital vein, and this is a vein that crosses the elbow. It crosses between the cephalic and the basilic vein, which is why I wanted to mention those, because that's what it connects. And so this is the one that when they take blood from your arm, they will try to stick that median cubital vein to get the blood out of your arm. So left and right side are the same. You have a radial and ulnar vein, median cubital vein, brachial veins, axillary veins, subclavian veins, brachiocephalic veins. They're the same. No difference in right or left. All right, so some models. How would you find this? This is underneath the arm, so that would be the axillary artery and vein. Okay, these here that are going near the clavicle, those are your subclavian arteries and veins, right? So if you look at this model, this is going to be your subclavian arteries and veins. These are your axillary arteries and veins, subclavians. All right, it's going to go, it's hard to find a pen that works, that shows a good color. Let's see, let's try maybe that, maybe black, maybe, okay. So this would be your brachial artery, okay, brachial artery. It's going to split. Here's your thumb, so here's going to be your radial artery. It's going to be your ulnar artery. Don't worry about all the extra ones, just the ones that I pointed out to you. All right, you can't really see the brachial vein on this particular model, but you can see the cephalic and the basilic. And I know that because this is the median cubital vein here, and so this would be the cephalic and this would be the basilic. Now in this, the hand's turned over, okay? So this would be the radial vein because the hand is pronated. All right, in this case, the radial vein is going to be right here. So pay attention to where that hand location. Let's see. All right, so we've covered your subclavians, your axillaries, your brachial arteries and veins, your ulnar arteries and veins, and your median cubital vein. All right, so make sure you can recognize that on that model. Here's another arm model. So the subclavian vein will be coming through this way. Now it's going to be coming underneath the arm. So we have an axillary artery. We have a brachial artery. The thumb is going to be here. So this is going to be the ulnar artery, and this is going to be, the radial artery. This is going to be the ulnar artery. So radial and ulnar. Going to pull it out a little bit further. So here's that brachial artery again, splitting into the thumb or the radial artery, and then the ulnar artery. Again, don't worry about these smaller and smaller branches. We're not concerned about those right now. All right, so the leg. The blood is going to come down the aorta, and remember, as it passes through the abdomen, it's called the abdominal aorta, And there's no difference between left and right when you're going to the legs. The blood comes down the aorta and it splits into a left and right iliac. So you have the common left and right iliac arteries. The iliac artery will then turn into the femoral artery. That artery then goes behind the knee. It becomes the popliteal artery. And then below the knee, it splits into three. You have an anterior tibial, posterior tibial, and fibular artery. So one's in front of the tibia, one's behind the tibia, and one's near the fibula. Okay, so if you remember your bones, this should help you remember how to find them. As blood's returning to the heart, it's going to go up the veins. So you've got an anterior tibial vein, you have a fibular vein, you have something called a small saphenous vein, a popliteal vein, a great saphenous vein, a femoral vein, and then the common iliac vein. All right, so the great saphenous vein goes the entire length of the leg. And this is one they'll often strip out and use for heart bypass surgery. It's also one that you may see if you have varicose veins. They may strip that out if you've got those big bulging veins in your legs. So that's the great saphenous vein. All right, so let's identify that on a model. So here's my abdominal aorta. It's going to divide into my right and left iliac veins. This is my left and right femoral veins. I can take these femoral veins and trace them down. It's going to go behind the knee. That becomes the popliteal vein. Staying behind the tibia, that's the posterior tibial vein. What did I say? Femoral artery. Oh my goodness, it's late in the afternoon. Femoral artery, popliteal artery, and posterior tibial artery. It's going in front of the tibia. This is going to be your anterior tibial artery. All right. And where this is kind of branching off, that would be your fibular artery. Okay, so they don't really show it. It's kind of branching off and going around to the side of the leg. Let's see. So your veins, this one here, this is your great saphenous vein. Okay, this is going to be your femoral vein. This is going to be your anterior, this is your, let's say it's great saphenous. This will be your, fibular vein right there. Actually, it's going to be your small saphenous vein right there that we're seeing. So this is your small saphenous vein. All right, so looking at models, you're going to have your femoral artery and vein, and that's the femoral vein. Again, let's kind of go down and look at the lower leg. That if you're looking at this is the dorsal, the plantar side of the foot, so you're looking at the back side of the leg. This is the popliteal artery, and it's going to divide into the fibular artery on the fibular side. It's going to go behind the tibia as the posterior tibial artery, and then it's going to kind of go around to the front of the tibia as the anterior tibial artery. So I'm going to use a mixture of models and images for your exam. I mean, we just don't have models that are good enough to show everything, so you'll see a nice kind of mixture of diagrams and models for the lab test. As blood is going back to the heart, you have your posterior tibial vein, you have your small saphenous vein here, you have your fibular vein, your anterior tibial vein, your popliteal vein, and then this is your great saphenous vein. So again, pay attention to the images and also to the models. Again, watch Miss Graham as she does the lab as well, because she can kind of point to them and show you those as well. We're trying to show you as many ways as we can so that you guys don't actually come to lab. All right, so one more model picture. This is the back of the leg. So this is going to be the popliteal artery there. If you're looking, this is going to be the tibia. This is the anterior tibial artery. This is the heel, so this is going to be the popliteal artery, popliteal vein. This is going to be the posterior tibial artery. All right, so there's really not that many arteries and veins that you have to learn for the arms and the legs, so I'm going to stop again at this point, and I want you guys to review the major arteries and veins of the heart. I want you to review the major arteries and veins that go to and from the head, your carotids and your jugulars. and I want you to review the arteries and veins that go out to the arms. Your brachiocephalics, your subclavians, your axillaries, your brachials, your ulnars, and your radial arteries and veins. Okay, so take some time to review those. Watch Miss Graham's video on those arteries and veins, and then we're going to move on into the arteries and veins of the abdomen. So these are the ones that go out to the stomach and the liver and spleen and intestines. Okay, so thank you again, and I will see you in the next video.